think about in your organization your current role and how you can actually help the organization be successful in moving forward. And sometimes people want to dig their heels in and say, wait, it's not my job to help the organization to be successful. Well, at the end of the day, it kind of is, right? So if we all want to remain employed and do a good job for our communities, we need to have organizations that thrive. And to do that, I think it's a matter of how can we contribute. And part of that, in my opinion, is you have to be really smart about what you're doing today, but also what you're going to be doing in the next year or two. So to do that, I like to encourage nurses and leaders to go learn as much as they can about what's changing right now, not only in technology, but in care transformation, and figure out what's out there.
Welcome to another powerful episode of Beyond the Bedside. I'm your host, Mike Duggan, and today we have the pleasure of visiting with Dr. Bonnie Clipper, who is a distinguished nurse futurist, virtual nursing pioneer, and nationally recognized thought leader in healthcare innovation. With extensive experience in nursing leadership, she has been instrumental in integrating technology to transform patient care. As a global speaker and strategic advisor, Dr. Clipper continues to shape the future of nursing by advocating for innovative solutions in acute care settings. Bonnie, thank you so much for your time today and to join us here. I know our viewers are excited to hear your insights. Let's start by helping them and our audience here really get a sense of who you are. Can you share a bit about your professional journey and what inspired you to focus on innovation within nursing?
Thanks, Mike. It's a pleasure to be here with you today. My journey has been probably a little bit unique. I was a nurse for 5 or 6 or 7 years, med surg, critical care, transplant, things of that nature, and realized that in order to create change or to do things differently, you had to be someone that was viewed as some kind of a leader. So went back to school, began my leadership journey as a manager, director, chief nursing officer. I was a CNO for about 20 plus years and had the amazing good fortune to become a Robert Wood Johnson Executive Nurse Fellow. And part of that process is that you actually need to pick a topic that you are going to contribute to the rest of your professional career. And at the time, this was 2014, innovation was starting to pop up, but there was really no literature, evidence, no research on innovation in nursing. So I partnered with 4 other Robert Wood Johnson Executive Nurse Fellows, and we actually spent almost 2 years writing a white paper, the Innovation Roadmap, a guide for nurse leaders. You can still find it available free today. It's on the ANA's servers. And that was a seminal work. And what we were able to do was not only to explain innovation, but get nurses interested and create a way for them to understand how innovation could actually help us improve nursing practice, improve patient outcomes, improve efficiency, access, all of those kind of things. So that was kind of a pivotal moment for me that really created the springboard for that next step. And the next step for me was really to think about how do we get more nurses into the innovation space, and how can we also integrate technology? So I truly had an amazing experience to be the first vice president of innovation at the American Nurses Association, which was an incredible opportunity to really understand the needs of nurses around the country and how we can begin to cultivate an innovative mindset. So began that work in 2017 and 18, 19. And for me, that continued to then show me that there were a lot more opportunities and a lot more needs out there. So that's really where I started to tap into what nurses can do and how nurses add value to a variety of different conversations, whether they're technology conversations, whether they're innovation in care model redesign conversations, or if it's literally just around how do we find ways to transform nursing practice. So that was kind of a fun way to get me to where I am today.
That's amazing. Thank you for sharing that. What a great journey. And we'll be sure to add that resource when we publish this live for viewers to be able to check it out. One of the areas that you have a passion in is virtual nursing, right? And it's just one of the components of the many different roads you mentioned. But for those of our viewers who may not know or who haven't given a lot of thought to this, let's start with what is virtual nursing, And how does it function within an acute care hospital?
Yeah, that's a great question. I was super lucky. In 2000, I was part of a health system, and we actually started making site visits to begin to adopt virtual, what we now call virtual nursing, but literally the technology platform and the services to integrate virtual care. We ultimately decided not to do that. It didn't meet the use cases that we were exploring at the time. But virtual nursing is not new. It's literally been around for 25 years. We've seen it for quite a while in different iterations. And now what we really are starting to know as the modern day virtual nursing is the ability to leverage technology, whether that be tablets or mobile carts or ambient computer vision. And it requires nurses that are direct care, so boots on the ground. And it also requires nurses that are practicing virtually, so in a remote capacity. And when you bring these three pieces together, the direct care nurses, the virtual nurses, and the technology, you essentially create a system that is virtual nursing or virtual care. How organizations operationalize that is different in every single organization. We deploy ways for different systems to figure out how they want to develop their care model and ultimately build and launch their care model through the Virtual Nursing Academy. And what we've seen is that everyone's using it slightly differently, which is actually awesome.
Yeah.
We're seeing it used in admission, discharge, transfer. We're seeing it used in patient education, reassessment of pain. We're seeing it used from different disciplines. So care coordination, case managers, PT, OT speech, RT, pharmacy. We know physicians, NPs, PAs. We have virtual nurses using it. We're seeing growing use case right now around wound care consults being done virtually. So it's literally limitless, whether you're looking at it from a home care or an outpatient perspective or an inpatient perspective. It almost doesn't matter where you fall on the care continuum. It's a matter of what's the problem that you're trying to solve. And there's a use case for the technology, and there's a technology that fits everyone's budget. So it's really kind of cool how this has been evolving very rapidly. And I would say the pandemic was really the catalyst for this last 5 years.
I believe that it's amazing how broad of scope that these types of projects can wrap up anything, right? The benefits are numerous, but what would the primary benefits be from your standpoint for both patients and the healthcare providers? What types of things are they just so excited about or raving about on the back end of some of these implementations?
Well, again, it's going to go back to the technology that you use and what you're trying to do with it. So you can absolutely do virtual nursing from a tablet, right? You can do admissions, discharge, transfers, patient ed, and it's faster for the patient. And typically we see this for a couple of reasons. And primarily it's because when you utilize virtual nurses, their focus is literally admit, discharge, transfer, education, whatever your 5 or 6 use cases are, they're experts at that. That means that they're much faster, they're much more proficient, they're much more accurate in documenting. So what we see is that when there's that trade-off and you deploy virtual nurses, that means you are able to take away that documentation requirement from the direct care nurses. So that's a win for them. It's faster and more accurate. It's a win for the organization, and it's a win for patients because now you literally have the discharge pro or the admit pro or the medrec pro doing the documentation and having that conversation with the patient. Much as you and I are talking today, monitor to monitor, we're able to do that with patients, and patients are having a good experience. Oftentimes organizations think that patients aren't going to like that, but in fact, the time, even though it's typically fewer minutes, it feels better because we're focused. My cell phone's not going off, my pager's not going off, people aren't poking their head in the door to tell me about the next patient or my post-op that just showed up. So it feels better to the patients, and it's so much more effective. So I think we're seeing some really good outcomes starting to emerge out of virtual nursing. There's a lot of one-off kind of anecdotal outcomes from organizations that have implemented across the country. We don't yet have any multi-site studies, but we're seeing patterns emerge. And those
Mm-hmm.
benefits are a reduction in length of stay, a reduction in readmission. When you have a virtual nurse doing the discharge that's really good at it, They're much more thorough at the med rec. They're much more thorough at the patient education. They're much more thorough at answering any and every question a patient or a family has. That all lends itself to reducing readmissions. So we are seeing some outcomes. Nurses, this is fascinating, but every time we help an organization out, it's almost the same curve. At the start, when you begin talking about virtual nursing, they're very cranky. They say, don't, you're not going to replace my job. We don't want this. Just give us the nurse and we'll use that person to do our own admits and discharges. Once you actually put the process in place and get about 6 to 9 months into it, then they say, don't take these virtual nurses away. They've made my life so much better.
So
I'm
much
not
easier.
documenting all day long. I have help now. So we've seen this in almost every occasion where the nurses at the bedside really begin to warm to it and then truly appreciate that as an asset and a benefit to them.
Absolutely. And those are meaningful outcomes, reduction of readmission, better quality of life for the nurses, engagement on our end since we recruit, right? It's a lot about engagement with the nurses and how they feel in their positions with their leadership and anything you can do to empower these nurses, these physicians, the leadership itself, especially to be able to focus on doing what they really want to do in terms of taking care of patients and providing quality care that's affordable is really an into or a means to an end in and of itself, right? And so I think it's wonderful all the different applications this has. From an emerging technology standpoint, looking at the various types of things people are looking at or deploying, which technologies do you believe are most promising?
Ooh, that's a little bit of a loaded question. From a virtual care and a virtual nursing perspective, like I just said, you literally can see success in a virtual care model from tablets all the way over on this continuum of technology to ambient computer vision and sensors. It's a matter of what problem are you trying to solve and what's your budget.
Okay.
So I think there's amazing promise there from a virtual care perspective. And if you adopt a crawl, walk, run methodology, you can begin to put the process in place with some of this lower price point technology to really do proof of concept testing and come up with models that work, and then begin to upgrade your technology in a couple years and then maybe upgrade again in a couple of years. On the flip side, what also has tremendous promise, in my opinion, is artificial or augmented intelligence that helps us offload things that nurses don't need to be spending their time on. So, for example, we can utilize the technology that is out there today to not only help us create a schedule, but help us predict staffing different units throughout an entire hospital or a health system, because it knows it can predict and see into our system the number of admits, discharges, transfers, ED holds, anything. And as it gets really good at predicting, it literally can be very dynamic and adjust our staffing. So those are things that exist today. What impedes us is often ourselves in a couple of ways. One of them is we have to have tools that work so we can trust the systems. And the other is that it is ongoing change management. So there are some things that we have to let go of and put in place. From a nursing perspective, when you talk about true nursing practice, my philosophy is you start with building a framework with the easy stuff, right? Easy stuff. You give away staffing, you give away scheduling. Always has to be a human in the loop. Always. We're not absolved of that responsibility and accountability, but we can utilize those platforms. On top of that, let's begin to look at utilizing AI to generate consistent care plans and help us create our workflows for each patient every shift. And layer on top of that, it should be standard practice that we are utilizing AI to assist us in identifying high-risk patients for sepsis, for CHF, for COPD exacerbations. It doesn't matter if it's inpatient or outpatient. There's so much data we generate on every patient nowadays. Let's use AI to help us predict what that means and what's going to become of that. That's where we really do well as nurses, is we actually can intervene with nursing practice and what now are we going to put in place from an intervention perspective to do with all of that data or those recommendations and suggestions from AI. So I am not suggesting that there are no AI nurse robots today or on the horizon over the next several years, but there are things that we can begin to give away to AI so that it allows us to do a much more meaningful and better job with the direct patient care.
That makes a lot of sense. I can see how that could be met with open arms and some hesitation depending on how people feel or what their experience with AI has been. I've heard a lot of wonderful examples so far, like dictation, for example, making life a bit easier for the physicians on their end. So if you're a hospital leader and you're looking at implementing virtual nursing or whatever type, however you want to frame it or call it, but what types of challenges do hospitals typically face when they try to adopt these types of programs? And any tips on how to overcome or step past those initial roadblocks or challenges they face?
Yeah, that's a really good question. And, this is the never ending change management initiative or project. It literally never goes away. So you have to do a really good job at creating a vision and communicating that vision. We also recommend that you utilize a super easy change management framework. So we're huge fans of the Cotter 8-step change model. And that literally allows you to kind of create a coalition. We often say work with the willing, right? Start with people that are excited, and then you eventually are going to get around to those that are your resistors or your saboteurs or your barriers. You have to figure out what your strategy is from a change management perspective. Otherwise, you have all of the really engaged, well-intended people working their tails off to make this work. And then behind the scenes, you have your saboteurs and your barriers that are kind of undoing things or creating negative messaging. So
Mm.
you really have to lean into what's the vision, what does success look like, measure it to prove it, and then you're going to continue to iterate along the way. And it takes a while to come up with something that works. It may take you 9 or 12 months to come up with an admit or a discharge process that works for the organization. And then you have to prove it to the organization through metrics. You have to communicate it over and over and over and over again. So none of this is easy work, but it's happening all over the country. So
Hmm.
it's pretty consistently being successful.
Absolutely. In a number of different ways. I think I really resonated earlier when you mentioned it's kind of case by case basis. Each system will look at it differently, what challenges they need to overcome, problems they need to solve, what resources they have, how they look at it. What are some of the examples you could provide in terms of, some of the success you've seen from, implementations and their outcomes? Is there anything top of mind that you think people would be really interested in or maybe haven't thought about in terms of gains from?
Yeah, it's a cool way to begin to reduce your ED hold so you can actually start to move your ED patients through the continuum faster. And when you think
Mhm.
about this, again, every organization is so different. But in the case that you're looking at improving throughput, thinking about where your discharge is happening, what time of day, what days a week, what units, because you have to get patients out of beds before you can get new patients in beds. So as you think about it, the data holds a lot of answers for you.
Mhm.
And thinking about how do you take your data and what you know today and then begin to create action plans around that. Every use case that you want to implement in virtual care means that you have to create a new set of workflows. So you have to make sure that you not only have engaged leaders, but you absolutely need to have direct care staff involved. They know the problems and the issues that any new change is going to create an impact. So it's really important to have a good core team involved and then think about what is it you want to do. From an ED perspective, there are some organizations that are doing some really cool work on discharges, which means that you can then move the ED patient into a bed faster. And in fact, you can have your virtual nurses doing the admit while the patient's still in the ED.
Oh,
So
wow.
it really does start to plug these pieces together and make things work better.
Yeah, so much of it seems to come down to efficiency. I know here we're always looking at ways to become more efficient, offer faster, higher quality service to our clients, which are, primarily acute care hospitals and medical groups, right? And it's a constant opportunity to embrace some of this technology. And lately, we've gained some wonderful efficiencies on our end. So I can only imagine how that can relate to real dollars for a hospital in tightening up their billings, getting that actually paid, with all the having all the checklists of what they need, and then of course moving people through as far as having, left without being seen numbers drop, door to dock, door to bed, numbers improve. Clearly, the world is abundant in terms of opportunities here for improvement. But looking at the next, decade, how do you envision, or do you have some kind of great vision as far as what this role of virtual nursing it could evolve to within those 10 years?
Yeah, absolutely. In my opinion, it's going to emerge as a standard of care probably in the next 5 to 7 years.
Wow.
So I think what that means is that organizations, because technology can be very expensive, I think we're going to see more organizations begin to adopt at lower price points, whether it's tablets or mobile carts, but get something in place over the next couple of years while we continue to iterate and change and really maximize what we can do with virtual care. It's going to be one of those things that new nurses want to have a safety net and want to do a good job. And also because younger emerging nurses are so tech native and tech savvy, that for them, working in a hospital that has virtual nursing is a no-brainer, whereas working in a hospital that doesn't have virtual nursing is going to be a turnoff. So I think from a recruitment and a retention perspective, we're absolutely going to see that choices of where to work are going to be driven more and more by access to the virtual care team or to technology.
That's really interesting. I hadn't thought much about that, but we do see that already with some systems might be on paper in certain ways still, right? Whereas some are on EHRs like Epic that are much more advanced. And even that is a quality of life difference, right? For the people working in these jobs. I could really see how that could be impactful in the years to come. So innovation is, part of our show because, healthcare is ever evolving, of course, like any industry, and tackling these opportunities to improve, create with the end goal of higher quality patient care is so important. But what steps can nurses and healthcare leaders really do or take to foster a culture of innovation, people accepting that change, right, within their organizations?
Yeah, I think that's a super question. And there's a couple different ways to approach that. So, one of them is think about in your organization your current role and how you can actually help the organization be successful in moving forward. And sometimes people want to dig their heels in and say, wait, it's not my job to like help the organization to be successful. Well, at the end of the day, it kind of is, right? So if we all want to remain employed and do a good job for our communities, we need to have organizations that thrive. And to do that, I think it's a matter of how can we contribute? And part of that, in my opinion, is you have to be really smart about what you're doing today, but also what you're going to be doing in the next year or two. So to do that, I like to encourage nurses and leaders to go learn as much as they can about what's changing right now, not only in technology, but in care transformation, and figure out what's out there. There are a ton of ways you can do that for free. So edX, Coursera, lots of free courses to continue to improve your own skill set, whether it's around AI, whether it's around care transformation. So I think knowing what's coming is one, educating yourself on what's out there is two, and then helping to become a change agent for your organization is three.
Wonderful. Thank you so much for those insights. What we talked about today is so important, especially with the future of healthcare, right? And people like yourself are leading the way, as a thought leader with this innovation. So many people look to you for inspiration. And thank you so much for sharing some of these thoughts with myself and with our audience. We are really looking forward to continuing the conversation and helping people move forward within their organizations. Is there anything you'd like to add to our viewers or to leave them with that we haven't discussed today?
I think this has been a really great kind of high level discussion about where we're going in nursing, from what does nursing look like in the next 5 to 10 years, and also how everyone can help sort of contribute to what does not only the nursing profession look like, but how does patient care interact with patients, and what does that really begin to pan out over the next couple
Mhm.
years. So I've appreciated spending the time with you today, Mike.
Well, thank you so much. Again, thank you from myself and our audience for your time and your thoughts, and we'd love to have you back in the future. In the meantime, best of luck and thank you again.
Awesome. Thank you, Mike.
All right. Thank you, Bonnie.